Hi, I'm Carmel Pearson. I go by Mel. I've been working with children with special needs for the last 20 years. I have master's degrees, well, actually 2 master's degrees in special education. The first one was to teach, so as a master's in special education with certification. And the second was with an emphasis on behavior analysis. I've been teaching in special ed classrooms for the last 20 years, fell in love the first time. Many of the kids had autism, but all of them had behavior issues, and I just love it. I got interested in ABA actually because I was working in these public school behavior units, and some of the behavior units actually use restraint and seclusion, and they said that it was the most ethical way to handle behavior, but I saw very quickly that behavior was getting worse. So if a procedure is working right, then the behavior should get better. But we were putting kids, restraining them and putting them into timeout, and the behaviors were getting worse, and they were going in more often. And I started to say, I don't think that this is the most ethical way and the most research-based way to handle behavior. And so I started looking outside of what I had been told and said, literally Googled what I wanted to do, which was to help people with behaviors in the homes, and behavior analyst came up. So I went to look around, and at the time, and this was about 5 years ago, the University of Utah was the only one that was providing, and it was their first year, a behavior analysis course of study. So that's what I did. I went and I said, let's get started and find out what the latest research says about changing behavior.